Good morning good morning to everybody who's here. Thanks for coming on a Sunday morning. This is going to be like a info session about the GI stool sampling test that I do with Genova Diagnostics. It's something that I've been doing for about 5 years. I started out doing it. So as a medical herbalist, we're not trained in specifically in these laboratory tests, though we are trained how to interpret laboratory results. But the reason that this came about, me using this test so much, was because I had a few patients who had really bad eczema and GI symptoms. GI means gastrointestinal, GI symptoms. And after 6 months or so of treatment, we were making progress, but we couldn't quite seem to hit the nail on the head. And it had occurred to me that the stool sampling was something that we could do to get more definitive answers about what was going on. So I did it. The patient was interested in doing functional testing and open to it as an adjunct to the treatment that she was already doing with me. And when we got the test results, we were both quite surprised by the amount of information that we got from the test. And so then it just started to build more and more and more. And now I'm doing these kind of tests almost on a weekly basis for people. And so the point you have to excuse me, I've just had a really bad cold, so I'm still a little bit uh, suffering with symptoms. So please just be patient with me. So the point of this is because I think a lot of people hear and have information about the importance of the gut microbiome and how the information that we have about the gut microbiome can help us with our health journeys. And so I'm here to tell you more specifically about this specific test that I do and how I work with it as a practitioner. So I'll take you through it. So what's interesting is that this test, this is not a basic stool test. So this test, the quality of this test is not the same as a stool test that's done at a doctor's. So a GP, mainstream doctor, is doing an extremely simple stool test, and they're usually looking for things like bacterial infections and inflammatory markers, but they don't go to anywhere near the same depth that this test does. And I'm going to show you a sample result as well, so you can actually see the level of details that it goes into. And I'll email that through to everybody so that you get a chance to have a look at that as well. So this test is not a basic test, and it's not about chasing bugs. So the GI effects stool analysis from Genova Diagnostics assesses multiple aspects of digestion. And this is what's different, and I guess this is where information becomes important, because digestive function, as I say to my patients really regularly, is not just about what's going on in your gut microbiome. There's three parts to it. So this test looks at how well food is being digested and absorbed, whether inflammation is present and how severe it is, the strength of the gut immune system, the balance and resilience of beneficial bacteria, and whether pathogens are clinically relevant or simply bystanders. So instead of guessing, we can finally see what is driving symptoms, what's blocking the healing from taking place, and what to treat first. So this matters, especially if you've tried everything. If you've been one of those people who's done quite a lot of reading on the internet, you've looked at probiotics, you've looked at different style diets, you've considered different natural therapeutic approach to addressing your digestive issues. But the thing is that many people don't improve because treatment is done in the wrong order, or they're not taking everything as a whole. And this is where I see the main issues as a practitioner, is that the amount of information that people have gleaned off the internet or from following somebody on a social media platform, for example, they're looking at one part of the digestive system. So maybe they're looking at Maybe they think that digestive issues are caused by microbial imbalance in the guts. But that's not how simple the digestive system is. The strength of the digestive system also needs to take into consideration what the upper digestive organs are doing. What's the gut microbiome like? Is there any inflammation in the digestive tract? And what are the intestinal mucous membranes like? So the intestinal mucous membranes get very, very overlooked. So, for example, people do these kind of things, which is how they make mistakes when they're dealing with treating the GI tract. So they kill bacteria when digestion is weak. They use antimicrobials while the gut lining is inflamed. They add in probiotics when immune tolerance is low, and this can all stall healing or make symptoms worse. So this test allows us to sequence treatment properly, supporting the gut step by step so changes actually last. So this is, you might be thinking about, why would I want to do the stool sampling? So you might want to do the stool sampling if you've tried probiotics, if you've tried elimination diets, if you've tried supplements, if you've tried antimicrobial or antiparasitic protocols, and yet your symptoms keep coming back. So the problem is not the lack of effort, it's the lack of clarity. So most gut approaches focus on what to kill or how to redress microbial imbalances. But healing happens when we understand what the gut actually needs on an individual basis with support first. So, and this is exactly what this test gives us. So, when you do the stool sampling with me, you don't only do the stool sample test, you also get to do an in-depth questionnaire as well, a health questionnaire. And that health questionnaire is my consultation form. And that consultation form gives me all the information that I need in order to evaluate your situation on an entirely individual basis. And so then that combined with the stool sample test allows us to approach this individually. And I was saying this to somebody yesterday too, that, you know, skin and all health issues are about treating the individual where they're at. That's what gets the best results. It's not about taking what problem they have. So that might be like ulcerative colitis, or that might be diarrhea with mucousy stools, or that might be eczema. It's not about treating the condition, it's about treating that person who has that condition. And that's a really different approach, because the individual approach means that everything about them needs to be considered. And then when you get your stool sample analysis, we run through the test results, you get feedback on that test results. But the treatment plan also includes what we're going to do, what I'm going to do for you, and how I'm going to achieve that. And then the herbal remedies are tailored individually for your set of circumstances. And that's not something that you can get from like AI. Like, even if you, I've run these tests through ChatGPT, for example, and they're really great. They give really great results. But what AI can't do is that AI can't interpret you as an individual and give you an individual treatment plan. So that's the thing about clinical practitioners. They're looking at how to sequence the treatment, and my protocols look at providing you with a stable sequence of healing. And there's certain things that we have to do first so that other things have a better chance to get better significantly. I hope that makes sense for you. So, yeah, so when you purchase this test, you don't just get a report, you get a clinical interpretation and a clear plan. I translate complex results into simple language. I identify the primary root causes, and I prioritize what to work on first and what to leave alone. You get a personalized, gentle treatment plan using foods, herbs, and targeted support. It reduces overwhelm, it gets rid of unnecessary supplements, and it's absolutely not a let's try and see what happens. This is a specific targeted treatment. So, healing the gut isn't about being more aggressive, it's about being more precise. And this test helps us to create the map that you need in order to guide you from illness to wellness. Okay, so I'm going to run through what the test actually is. So let me just find my notes. If any of you have got any specific questions, please will you start dropping them into the chat? Like if you're here, if you've got, like, let's say you've got a particular health issue or you're wondering about taking a next step in terms of your health journey, please drop the questions into the chat box and then I can start answering them as we reach the end. So, what I'm going to do is I'm going to actually show you uh, a test result. Just bear with me 1 second. Mm-mm-mm. 1 sec, let me just find it. Okay, so I'm just going to share my screen so that you can see this. Okay. So here we go. Now you should be able to see this. So this is a sample report from Genova Diagnostics. So this is what the test results look like when they come back. So it's 11 pages of results. So what I'm going to do is that I'm going to talk through it a little bit so that you have some idea of what it is. So like I said, so the purpose, so this test is about functional digestion, inflammation, and microbiome balance rather than pathogen only testing, which is what the GP does. And even the GP's results, the pathogen testing that they do is not as detailed as this is. So, the purpose of the GI effect test, so the test is designed to move beyond pathogen hunting and instead access how well the gut is functioning, which symptoms are occurring, and which symptoms need support first. It integrates digestive capacity, immune activity, inflammation, and microbiome ecology into one report. So the core clinical sections explained. So the first one is digestive function. So if we go down to, so what you see when you get your test results is this. Okay, so these 5 pillars have represent different aspects of your digestive system, and they're scored on a scale of 1 to 10. Sorry, 0 to 10. 0 being nothing, and 7 and 10 being the highest it could be and in need of support. You also get some gentle but non-specific guidance from Genova Diagnostics in terms of the therapeutic support options that you can, if you wanted to just do the test, you can take those and on you go and try those out and see what happens. As we go down into the test, it gets more detailed. So what it's looking at, so let's let's go down to page 4. So page 4, I'm just going to move this across actually. Sorry, I just need to get my notes on the other side so that I can see them properly. So here we go. So these are the three main things. These are the three main aspects that are covered by this test. So number one, we've got digestion and absorption. We've got inflammation and immunology, and we've also got gut microbiome metabolites. So metabolites means the byproducts that are produced by the microorganisms in the digestive tract. So the first one, so digestive function. So this one focuses on whether food is being properly broken down and absorbed. So pancreatic elastase, so all of these things, pancreatic elastase, fat and protein breakdown markers, these are indicators of maldigestion and give us information about what's happening in terms of how your upper digestive organs are functioning and how they might be improved. So poor digestion alone can drive dysbiosis and inflammation. So this is of relevance. So understanding these things about digestion and absorption in conjunction with the gut microbiome are important, because if we don't know what digestion and absorption is like, we can't have a true understanding of what the gut microbiome is like, because digestion itself, the function of digestion, can drive dysbiosis and inflammation. So it gives us a clinical indication of how we might start the treatment, because, for example, by working on improving upper digestive function, we can then influence what the gut microbiome is going to be like further down. So we've also got inflammation and immune markers. So these are about assessing the gut lining and immune activation. So this is really, really important here. So calprotectin is an inflammatory marker. So calprotectin can be high in conditions like inflammatory bowel disease and shows us where we might need to work on certain things to reduce the occurrence of that. Secretory IgA, this is really important when it comes to looking at gut function, because secretory IgA is the main way that we look at and assess how the mucous membrane is functioning. And why is this important to digestion and to general health is because the mucous membrane is meant to be, the intestinal mucous membrane is a semi-permeable membrane. It requires it to have integrity and low levels of cellular inflammation in order for it to function properly. So the mucous membrane prevents particles from passing from the inside of the digestive tract into the bloodstream. And this is important because this is also known as leaky gut syndrome in kind of layman's term. So where particles are passing from the inside of the where too many particles are passing from the inside of the intestinal tract into the bloodstream, these can activate, this is what allergies are caused by, but it also activates things like eczema pictures or other inflammatory pictures in terms of our health. Because if we're lacking integrity in the mucous membranes, there's way too much leaking and your immune system is really, really activated, which is what can be driving your digestive symptoms. So the mucous membrane, we're born with a really permeable mucous membrane. And if we were not to be subject to any inflammation in the digestive tract or challenges within the digestive tract, according to what our gut microbiome is like, the permeability of the mucous membrane would become more integral as we become older. So it would mean that we would have no digestive issues. But because that's not the case in many people, so many people have compromised mucous membranes, aka leaky gut syndrome, going on. their health is affected, but they don't know because leaking gut syndrome is not something that is a very strong clinical presentation. It's not like, oh, it's definite that you've got leaking gut. But when we do this stool sample test and we can see what's going on with the secretory IgA, we clearly understand what that mucous membrane is doing. There is another part of the test that helps us to understand the mucus, the function of the mucous membrane, presence of the species Akkermansia in the gut microbiome. So we've got different aspects of this test that contribute towards giving us loads of key information about which parts of your body are compromised and to what degree. And then as a clinician, I know how to then rectify those problems with the remedies that you need, the diet that you need, and the approach that you need. So that's that. So the gut microbiome, these are all this for those who are interested, this is a PCR based test. So the rather than naming organisms, the report evaluates the commensal bacteria, opportunistic organisms, and overall balance and resilience. So one of the things that I really love about this test, let me show you here on page. So here, this relative commensal abundance, this shows us, these are the 7 major phylum, that's families of microbes that exist in your gut. Not all microbes have a pathogenic effect, so that means that not all microbes cause disease. We have lots of microbes in our system that are there for lots of different reasons other than contributing towards disease. But this test has a deep analysis into what each of these different species are doing and how they're performing in relation to each other in the context of the whole of the digestive tract. If any of you are as geeky as I am, I literally live for these results, like these detailed results about the gut microbiome. I really pore over them because I find them really, really fascinating. So, what should happen is that we should be around here, around the healthy cohort, which sits in the middle. But you can see in this sample, there's some undergrowth in this species, there's overgrowth here, and then there's poor functioning in these 2 phylum as well. So, why this is important, because the health, our whole health, depends on us having a healthy gut microbiome. So that means the commensal abundance means that we want to be having good levels of good microbes and low levels of all of the poor microbes. So because about 80% of people in the general population have dysbiosis or an imbalance in their gut microbiome, having those details about what that specifically means that we can then do a really targeted treatment. So what's happening for a lot of people with poor digestion is something like this. So they've got low levels of good microbes and they've also got high levels of bad microbes. So the treatments is not just about reducing the bad microbes, it's about creating a better balance between the two, whatever that looks like for you. If you've had antibiotic treatment, you're probably going to have something like this, which really, really affects your health. And we know the gut microbiome plays so many different roles when it comes to health. So it affects not just digestion. This isn't just about digestion. And that means like, do you have constipation or diarrhea? Do you have mucus in your stools? Do you suffer from bloating? Do you have acid reflux? Do you have indigestion? Do you have intolerances to certain foods? Do you have allergies? Like, it's not just about that. It affects nervous system function. So it affects mood and cognitive function. It affects our sleep patterns and habits. It affects our ability to think. It affects our skin function and our ability to control pathogens and bacteria. There are lots of ways in which our gut health is responsible for every other aspect of our personal health. So this summary here, I'm going to show you the level of detail that this test goes into. So we're going to skip down here to this page. Just move this across. So this is page 5. And so this is the in-depth analysis of the graph that I just showed you before. So you can see here that here is the 7 major phylum. And then this is the analysis of each of some of the species within. So this is not the amount of microbes that we have in our digestive tract. It's actually way more than this, but these are the ones that they're testing for in this test. So other tests, you can have bigger tests. So the more in depth you go, the more expensive it is and the more complex it gets. So when you do this test through Genova Diagnostics, you can also pay for add-ons as well. So those add-ons also do additional as well as some of the aspects of your digestive health. So you can see here that these graphs represent how these microbes exist in your particular digestive tract. So here, for example, you can see that this is extremely low. So a healthy gut microbiome, we generally want to have a relatively even distribution in the 3rd quintile. And you can see here that there's a really uneven distribution. There's a lot of skewing going on. So then they go on to grow these out on Petri dishes to be testing which ones are showing up to be potential pathogenic. So it includes its bacteriology, so it's bacterial species. We also do other significant species. So these are pathogen causing species. And then we've also got mycology, which is yeast. This is one of the add-ons, the KOH, that you can do. So that's the microbiology that they do. And then the sampling also goes on to look at parasitology. So for those of you who know me or follow me on social media, I quite regularly post about how there's a lot of misinformation about parasites, and there's a lot of information out there's a lot of people who say, parasitic infections are responsible for everything in the body. And I say, if you think you have parasites, the only way to know is by doing stool sample testing. You cannot guess that you have parasites. And this stool sample testing has extremely in-depth analysis of parasitology. So this testing is more in-depth than what you would get in the GP. But what's good about it is that you're really looking in depth at a broad range of parasites that could be potentially pathogenic and contributing towards some of your issues that you might be presenting with. And it also means that you can do targeted treatment if you know the species. And if you suspect that you might have parasites or you worry about parasites, doing this test will show you which parasite you have and therefore how it's going to be treated. So that's what I know as the clinician, is how to treat these parasites. We have hundreds of medicinal plants that have anti-parasitic properties, but it's not, one of the problems with taking a general approach, a general sweeping guess. So like if you were to Google, I think I have parasites, what herbs should I take? You would only ever get general advice over general herbs. It doesn't mean that you're doing any targeted treatment. And what I want to link in here is that it's fine for you to do anti-parasitic treatments or antibacterial, antimicrobial treatments. But if you're not also tending to your mucous membranes and you're also not tending to how your upper digestive organs are functioning, you're not going to get a complete treatment, and you're definitely not going to get the needle to tip into health and wellness, because it requires other aspects of looking at your digestive health, not just treating a parasite. So that approach, excuse me, that approach of treating only one species is an allopathic approach. So that's how pharmaceutical medicine works. It's one chemical for one problem. And that's not what a holistic approach is. A holistic approach is about looking at the whole person, seeing what they need and how we're going to support them through that process. So I said this last week, actually, it's really interesting. People do anti-parasitic cleanses, but they don't take into consideration what the nervous system function is like. So let's say you've got like complex trauma, or you've got PTSD, or you're in a period of high stress. If you then go and do a parasite cleanse, you're going to put your body under more stress, and it parasite cleanse doesn't work, and then you think, oh, the herbs don't work. But the reason that your body isn't able to bring a resolution on that parasitic infection is because it also depends on the state of your nervous system as well. And so the thing the first step that you need to do actually is helping the nervous system to be more regulated and to have more strength in it, so that then your body can do the work that it needs to clear up the parasite. And it's interesting because stress also has a negative impact on the gut microbiome. So people are trying to sort out their gut microbiome without sorting out their stress, which is the driver of the problem. And so they never really get anywhere. And this was me for many, many, many years before I became a practitioner. I spent a lot of time trying to figure out how to solve my digestive issues. I had chronic candidiasis. I couldn't work out how to do it. And even though I did loads and loads of cleanses and I did loads of antimicrobial, anti-candida treatments, I just kept going round in a loop. So I'd get a bit better, but then something else would happen and I'd get another infection, and then I'd get a bit better again, and then I'd get another infection. And that's what I see a lot of people trapped in these cycles of repetitive poor health, and they can't seem to get out of that loop. But it's not that they're not doing enough, it's that they're doing things in the wrong order, and they haven't thought about, they just don't have that not level of knowledge to know what needs doing first and to do a sequential protocol. Excuse me. Does anybody have any questions just now? Let me see if I have put my
Hi Lucy, sorry, I was actually typing one out, but then I had a bit of a drama with my 4-year-old there, so I actually missed the last couple of minutes of what you said. But I was going to ask, and I'm really sorry if you actually just did cover this in the last couple of minutes. It was off the back of the antibiotics. See how when obviously when you get these results, and let's say let's use Harris as an example, I start working on his skin. Or working on his gut, sorry, and give him whatever he needs to do, or put him on the right diet, that kind of thing. And let's say he does start to show signs of healing and improvements. Um, Say he needs antibiotics, and I know obviously there's herbal options that you can use instead, but if there are instances where antibiotics are really needed, would that set you back again, or would, because there has been some improvements in healing going on, would it be not as would it take not as long to get back on track? If that makes sense.
This is such a great question, Nicole, and I can tell you, like, I personally was totally in that situation when I was a teenager because I had multiple things going on at once, and I'd done loads and loads of work on my gut health. And then I needed to have antibiotics, and I was absolutely devastated because
Mhm.
in my mind, I thought, oh my God, I've just put so much effort doing all of
Yeah.
this work, and now I'm having to have antibiotics and set it back. But the reality is that that's not the case. And where we need antibiotics, you should take antibiotics. Like if that's what's really clinically indicated, then that's what you should do.
Hmm.
And I think that the best approach in that instance is trying to be really understanding, like take away all of that kind of critical aspect of yourself, like seeing it as a failure, because it's not a failure. And it's about understanding that you have to do a little bit of work in one aspect. And yes, you might have some setbacks, but the other aspect of it, and this is what I learned as a teenager, is that you have to understand what you need after you've had antibiotics, right? So
Yeah.
here's what's really common in the States. Like when you have antibiotics, you also get given probiotics together, right? So they understand that when you have antibiotics, it does decimate the gut microbiome, but then straight
Hmm.
away you're doing the work to replenish the gut microbiome. And I really like that approach, and I like having that mindset about it, because if it has to happen, then all you can do is do the best that you can do to get
Hmm.
back onto the healing journey that you're already on. Do you see
Hmm.
what I mean? So
Hmm.
if you do have to take antibiotics, sure, it can feel like a kick in the teeth, but it's not, it doesn't take you all the way back to zero.
Right, yeah. Hmm.
It's really stressful thinking about
Hmm.
it, isn't it? Like,
I would never have thought twice about antibiotics before because I didn't know until obviously I had Harris with his skin. And now I've got the fear. Even with my wee girl, I'm like, oh my God, I'm dreading the day they might say, oh, there's an infection or this or that, ear infection, or we need antibiotics. And I'm just like, oh, are we going to just see total setbacks with his skin or?
yeah, I know, and
Mhm.
that's the case, right? Like, um, personally, I try to avoid antibiotics at all costs because
Mhm.
I know that I can't really afford them, because of how they'll set me back. But and the same is true with my children. Like my eldest child has never had antibiotics. She's coming up 13 and she's never had antibiotics, and I feel very lucky that we've never had to give them to her. But my youngest child has had antibiotics, and I was so surprised how well she dealt with them. Like she had 5 days of antibiotics, she took them. I supported her herbally on the other side of that, and she had no side effects from the antibiotics. And I think that goes to show that if you're doing work around diet and if you're doing work around supporting the general health, that's the best that you can do in terms of if that comes up, right?
Yeah.
And
Yeah.
then, all of the work that we do around supporting gut health, like that's why digestive health in a whole is really important. And it's like a full picture thing to keep working on. What you have to understand, Nicole, you're so at the beginning of your journey. Do you know what I mean?
Mhm.
I'm like
Mhm.
20, 20, 25 years in. I've got 25 years of experience, and it's like you can't compare yourself because it's
Mhm.
unfair. And
Mhm.
each year we just keep learning and developing our toolkits and growing and understanding like, oh, this is what I'll do when that happens. And I think it's one of those things one of my goals for this year is to write a protocol on what to do use because it's something that comes up all the time. And people say to me, I'd love to know what can I do herbally to support myself after I've had antibiotics. So at some point, I do aim on writing a document so that that's something that people can have so that they know like they've got a protocol that they can follow. But it happens. Does anybody else have any questions just now? Jane or Jacqueline or Nadia or Colin, are you all just listening and processing information? Yes, no. Maybe. Okay, so let's move on a little bit more. I need to find put this down so that I can see. So, so this is protozoa. This is, sorry, parasitology. So we've got more in-depth parasitology here as well. And this is some of the add-ins as well. I'll put some information about what the add-ons mean. And then here as well at the bottom of the test results. This is to do with bacteria sensitivity. So this is useful because what they do is that they take they take the microbe or the pathogen or the parasite that is overgrown in your system, and then they've tested it to see which natural antimicrobial agent is most effective for you. So you can see, so all of these ones listed, these are all different kinds of antibiotics that are shown to be, so you can see here that for Klebsiella, ampicillin is shown to be resistant. So ampicillin is not the antibiotic that you should be using in order to treat Klebsiella. That's what this is showing. But these are the other ones that are. And then they also go in to evaluate which natural agent, berberine, oregano, or uva ursi, these are all medicinal plants, have the highest inhibition against those agents. That's like For you as the patient, that's like not that relevant, and it's not that relevant to me either because we use more complex formulas that when we come down to treating. So this one, oh, this one's also got mycology on it as well. So this has got yeast as well. This also evaluates yeast in your system and whether or not you've got any overgrowth and what you can use against it to be effective. So that is the test results. Let's go back to the first page. So then so all of these different aspects of the test then come back and feed into these 5 columns that showed the summary of the results on pages 1 to 3. And then we can see how each different aspect needs to be approached. I'm gonna stop sharing this screen. So you know, so there's multiple things that we need to be working on when we're looking at addressing the gut microbiome. So we've got a restore digestion, we've got a calm inflammation, we've got to support the gut immunity, we've got to rebuild beneficial flora, and we've got to target pathogens last only if clinically indicated. So this is really, I just want to emphasize this, that this is really about individualized treatment plans. It reduces unnecessary use of antimicrobials, and it aligns super well with herbal, nutritional, and functional medicine approaches. So this test is especially useful if you have chronic relapsing, which means repeating, or pediatric cases that you are struggling to find solutions for. So the GI test effects. The GI effects test is presented as a system-based gut assessment, not a diagnostic label machine. So its strength lies in helping practitioners decide what to support first, what to leave alone, and how to sequence the treatment safely. So why would you be thinking about having this test done? You would be thinking about having this test done if you care about your general health, like if you want to have some idea about what your general health status is like, if you understand how important the gut microbiome is. You don't have to have the test done only if you're ill. You can have it done just to have an evaluation of what is going on in your body for you. But it would also be really indicated if you have any kind of digestive issues, or if you have any kind of chronic or complex health issues that you're unable to figure out. It would also be useful if you're a woman and you're thinking about conceiving and you want to really work on strengthening your gut microbiota, because we know that the state of the mother's and the father's gut microbiome at the point of conception influences the baby's microbiome as well. So a preconceptual care is really pertinent to getting your gut microbiome evaluated. So Nadia's just asked, just wondered, my daughter has cradle cap. Is that something that could signal worthy of a stool test? I've read it can be linked to yeast in the gut. Oh, really great question. So cradle cap. Cradle cap. People talk about cradle cap like it's super normal and that everybody has it and that it's nothing to bother about. And what's funny is that cradle cap is a clinical indication that there is yeast overgrowth in the system. And so is it worthwhile looking into the gut microbiome? I would say absolutely yes. Because if you it see what I find really interesting about the stool sample analysis test is the depth and breadth of information that it gives. It's not just about evaluating like, does this person have a yeast overgrowth? Because we know that the solution doesn't lie in just fixing that microbial issue. It lies in addressing all the other things that are going on. And here's what's interesting, Nadia, is that where people have microbial overgrowth that is presented by a clinical sign, and cradle cap is a clinical sign, a symptom. It often compromises the mucous membranes as well. So then it gives you more weight to be working on improving their mucous membranes as well as treating the microbial overgrowth. So it's something that's coming up for me more and more and more. So I work with a lot of babies who've got chronic eczema. Sorry, who've got complex eczema. So that's often eczema with allergies and digestive symptoms. And I would say that in something like almost 80% of the cases that I work with, they all had cradle cap at birth, or they had cradle cap from being a young age that took a long time to resolve. And the mothers often think like, I'm not sure that that's normal, but when they ask their health visitor or when they ask the doctor just says it's normal, it's nothing to worry about. And so they brush it off. But then what happens is that later on, those symptoms, more symptoms come up. And when you put the picture together, you can actually see that there's been symptoms occurring for such a long time. And then they're like, oh, that was the first marker. Why did I ignore that? And so from a from a from a traditional perspective, from a holistic perspective, we ask people to pay attention to symptoms. Like, symptoms is your body's way of communicating with you. And part of the problem is that even from a young age, we just brush things off, and we shouldn't be doing that, because holistic health is also about long-term health as well. So the work that you do with children, which is why I love working with children and babies, is because the work that you do in their infancy puts them in good stead for the rest of their life. Like, I spent a long time from 19 years old untangling all of my health issues that I'd accumulated for 19 years. And it took me a really long time. And, my lesson from that is like, why don't we do it from the beginning? Like, why don't we do it with babies so that then we can just spend less time unpacking our health issues further down the line? Does that make sense to you, Nadia? Does anybody else have any specific questions? Like, maybe you could all say like why you're interested. So if you could type, if you don't want to come on screen, that's totally fine. But if you want to type in the chat, like, just say why you're interested in the stool sampling test specifically. Great. You're welcome, Nadia. Nicole, you don't need to write anything because I know why you're getting the stool sample test done. But if Jane and Jacqueline and Colin, if you could all type why you're interested in the stool sample, that would be great. So Jane, thank you for sharing that. Okay, so Jane, I have an underactive thyroid and recently now have rosacea, which is affecting my skin on my face. Doctor gave me antibiotics to try, but making me think this is coming from a gut problem, which is a stool sample would be good possibly. So yeah, great. I'm sorry to hear that you've got that. Rosacea is caused by a microbial overgrowth on the skin, and it undoubtedly comes from an imbalance in the gut microbiome. I've treated rosacea loads of times, and it always stems in the gut. So when we were training as herbalists, that's how we were trained. So rosacea is a microbial imbalance in the gut. So, and you might have read that online too. So it definitely it definitely is worth looking into your gut microbiome, because it means that you can get more specific details on what's going on there. And the more specific details you have, the more specific outcomes you can get. So Yeah, for you, Jane, like I would say that's a definite. And yeah, antibiotics do work for rosacea. Like they often do a treatment called Racetine or something similar to Racetine, which is a 6 month process. And interestingly enough, I did a skin group, an adult skin group session yesterday, and one of the patients has rosacea. She did the 6 months treatment with Ractane, and it completely cleared her skin up, but it's only come back. So that's part of the problem with using antibiotics. It's only a temporary fix. So if you're looking for a long-term solution, I guess that's if you're looking for a long-term solution, then looking at your gut health, addressing your gut health is going to be the way going forward. I hope that's helpful for you. I hope that's helpful for you, Jane. So, Jacqueline, eczema has improved drastically since we started working together. You're welcome, Jane. But now I'd like to expand on the lab work and see how my digestive system is working as a whole. Yes. So I did mine. I did my stool sample testing not because I have any major health issues at the moment, but just out of curiosity. And it's the same thing. Like if lab work is one of the ways in which we know what our baseline is. So yeah, 100%. Like Jacqueline, that just makes sense that that's the next way forward. So So Colin had IBS issues for a while and fibromyalgia pain mostly in the mornings. Thanks very much for sharing that information. Question about the test you offer. So, Colin, your question is looking at your product page. It looks like the test at the price you offer is comprehensive microbiology. Oh, I'm not sure what this question. Sorry, Colin, you might need to help me. Sometimes I can't understand what the question is. So I
Sure.
don't
No,
know.
I was looking at the at your product page, the link you have on your website,
Oh
and
yeah,
it has a
yeah.
photograph of the codes of the different tests that's included
Ah,
from this. And I
right.
checked that with the company itself, and it has obviously it has about four different tests. But the picture you have on your page has the three tests, and there's an additional one that's not included. And I was just wondering what is actually included in the test that you've just explained this morning.
Right. Okay. Thank you so much for clarifying. Sorry, sometimes I just struggle to translate
No
information. So
problem.
if you go onto Genova Diagnostics, so what I'll do is I'll link that page to you now. So the test. So I'm going to put this in the chat, then I want us to be able to get to the answer. Oh, where have you gone? Let me put that down. Ah, here it is. Okay, so this is the Genova Diagnostics product page. Okay, so if you click onto there, they do this, the tests that I generally do with them is this GI effects test. Are you able to access that? So your question was, but not gut pathogen number 2207. Is it? So let me ask you this, Colin. What specifically are you looking to get answers on? Do you want to know about your general gut microbiome, or do you want to know about whether or not you have a specific pathogen?
I'm just looking to get as much information as possible to understand what could be going on, really.
Yeah.
So yeah, I think if I'm going to get it done, I'd probably just like to get as much covered in the one go, I think.
Yeah. So you you everything that's included, so all of the add-ons that are included as part of the comprehensive stool sample testing, I cover them. So everything that's included in that test is also included in my results. So if you were looking to get a test um out with the comprehensive stool sample testing, like I've also done things like SIBO testing before with other patients, like they're also covered. I guess you I took a photo of the stool sample kits box and put that as the product image on my website. It was just a general image. It doesn't mean it's limited only to that. And I wonder, it's funny that box that I've got. I never noticed that actually, but if there's things that you're not sure about, like if you want to make sure, like if you're going to invest in this and you want to make sure that everything is covered, like we can talk about that through emails deal with, but we work in collaboration with each other. So their tech. I'm so sorry. I'm so sorry. The Zoom link just completely dropped out. I'm back. Can everybody hear me okay? I'm so sorry about that. Yes. Oh, phew. Oh my days. Yeah, it was my connection. It just completely disappeared off my screen. God, that was a bit scary. Okay. Here we are. Um, and it looks like Colin's gone. Anyway, hold on, I'm just gonna check. Yeah, it's still recording. Great. Okay. Colin, I just want to make sure that I answered your questions. If you have any more questions, please let me know. So just to do a summary before we finish. So the test itself, the GI effects report, the test itself explains clinical rationale, structure, and interpretation of the GI effects stool test developed by Genova Diagnostics with a strong emphasis on functional digestion, inflammation, and the gut microbiome rather than pathogen only testing. So I hope that this session has been useful for you today to get a little bit more information about what this test is, what it's useful for, and why you might want to do it. Like, if you have any more questions, and for anybody who's not here today and watching this recording back, if you've got any more questions, please let me know. And the thing that I would say is that the main thing that most people said after having this test done is that they wish they'd done it sooner, because the depth of information that this test gives on a functional basis is phenomenal. And it's interesting as a practitioner, because when I sit and go through your case history and I'm focusing on some of the issues that you have, in my mind, I'm thinking about, I wonder which microbes might be causing this. And it's massively helped me as a practitioner to get more and more specific. So the more specific we can be, the better outcomes we can get. And I guess I say to people, it's kind of like fast tracking the work that we need to do, because as a practitioner, we take time to build the case, and that this solid data just gives us so much immediate information that we can do so much work with. So I would say it's an amazing test. I don't think that functional tests are the be all and end all of everything. They're not. It's about connecting and putting together the consultation, the holistic consultation, and the health questionnaire, plus the data, and that those things create a great picture to provide a really phenomenal individualized care plan. So if nobody has, does anybody have any other questions about the stool sample testing before we finish up for today? Hopefully Zoom won't cut out on me again. No, all good. Great. If you, Nicole, particularly for you, if you do have any more questions, please let me know. If you would like to go ahead and get a stool sample testing done, if if you're in that position, I'm offering a discount. I'm offering a discount on my website. So what I've done is that I have put this as a product on my website. So I'll just put the link here so you can buy it. It's a 15% off at the moment. So if you want to go ahead and buy that, you can. And then what happens is that I will get in touch with you to let you know that your kit has been ordered. Here, I'll put it here. So that discount is I'm gonna let that run for 48 hours, and then it will go back up to full price. That's my fee for all of the processing and the interpretation. So if you want to go ahead and book that, you can go and buy that right now. I hope it's been helpful. Thank you so much for sitting in and listening to me, and I wish you all the best on your health journeys. Take care, everybody. Have a lovely Sunday. Bye bye.